The National Coronavirus Command Council will meet next week to discuss the country's next step in the fight against COVID-19. South Africa has recorded over 730,000 cases so far, and they are concerned of a second wave as seen in Europe. President Cyril Ramaphosa is expected to address the nation thereafter that gathering.
Cabinet will deliberate the outcomes of the National Corona Command Council to be held next week. Yes, definitely, let's confirm that next week we'll have the NCCC, and after the NCCC, indeed, Cabinet will sit and deliberate on the discussions of the NCCC. After Cabinet, President Ramaphosa will brief the nation on the developments in South Africa as it relates to our management of the COVID-19 and the mitigation measures we have put in place to save lives and protect livelihoods.
Tembu adds that Cabinet is concerned about the irresponsible behavior of some South Africans. He's called on all citizens to practice safety measures to prevent the spread of COVID-19.
Cabinet is concerned that some people are behaving recklessly and irresponsibly as if COVID-19 no longer exists. Cabinet calls on all people in South Africa to continue adhering to the health protocols of practicing social distancing, wearing masks all the time when in public, and washing our hands with water and soap or an alcohol-based sanitizer. And of course, once again, we say we must avoid large gatherings because that's where infections happen. Such consistent, considerate behavior remains the greatest defense in protecting ourselves and others against the virus. Our responsible actions will ensure we minimize the rates of infections whilst we continue to build and rebuild our economy.
Right, let's stay with the coronavirus pandemic now. This is having a knock-on effect on other vital health services in Africa as countries are forced to redirect already stretched resources. The World Health Organization says today a preliminary analysis by the WHO indicates COVID-19 is having an adverse effect on other health services. Technical Officer at the World Health Organization's Regional Office for Africa, Dr. Mary Stephen, joins us now to tell us more. Dr. Mary, good evening, and thank you very much for joining us on the Newsfeed Late Night.
Good evening. Thank you for having me.
It would seem to me in our response in the continent, we did not factor in the fact that we would need to still continue with the other health services. A whole lot of focus was placed on the fight against COVID-19. For example, the suspension of surgeries in South Africa, the vaccination programs, even the distribution of antiretroviral drugs was one of those affected services. How bad is the situation in the rest of the continent?
Yes, we are seeing disruption in the essential health services like immunization, antenatal care, care for routine follow-up for other diseases, hypertension, diabetes, HIV/AIDS, and other chronic diseases. So this has been really greatly impacted because of the COVID. First of all, the attention that we have shifted from the services to the COVID response. Secondly, the fear of contracting COVID in the health facilities. So the patients try to shy away from coming to the facilities, and the lockdown measures has also reduced accessibility to the facilities and those essential medicines.
However, we have seen relatively low death rates in Africa and low infection rates when you compare to what we are seeing elsewhere where in the world in terms of these infections. Did we overreact in certainly curbing some of those services that are quite critical?
Okay, so I wouldn't say we overreacted, but Africa reacted swiftly. In outbreak response, early response plays a significant role on how you control the outbreak. The earlier you respond, you have a very good chance of curbing further spread of the outbreak. And if you respond late, of course, by then the outbreak would have spread. And of course, some of these measures that Africa implemented swiftly, from the public health measures, testing, contact tracing, the issue of treatment, isolation, as well as the preventive measures by the general population, hand washing, wearing of face masks, keeping the physical distancing, has helped Africa to cope and limit the spread of the outbreak, including, of course, the lockdown measures that governments have implemented.
Now, between May, June, and July, according to the preliminary analysis from the World Health Organization, we've seen a drop in some instances of close to 50% in those services that were monitored, which, of course, creates quite a huge backlog. What can those health systems, those countries do to recover from this and catch up?
So we have an opportunity to build back better with following the COVID response. So meaning that we have to take into account that the essential health services must continue whenever we are dealing with an outbreak. So this is a lesson that we have learned. It's not new, actually. Even the 2014 Ebola outbreak had impacted on essential health services. But what we need is a resilient health service that is able to manage with the shock of an outbreak, as well as provide services for routine health care.
Now, if you ask some countries, they'll tell you that the redirection of budgets has gone into, for instance, things like PPEs, social services, and some stimulus packages. But here you are, you've got 1.3 million children aged under 1 who have missed their first dose of a measles vaccine. What's the role that the WHO is going to play there, particularly in assisting those countries?
So for countries, for countries where you have children that have missed immunizations for measles, for instance, once the countries have opened up, of course, and the immunizations campaign has resumed. So what you need is to do a catch-up campaign to make sure that you cover these children with the missed vaccinations. And of course, continue to use every opportunity available to catch those that we have missed and make sure that they have the vaccines.
What's the confidence then? I see the director of the World Health Organization here in Africa, Matshidiso Moeti, saying that some of the programs or campaigns have started, particularly against measles and polio. What's your confidence in the catch-up and in improving the access as well as the outcomes for the continent?
Yeah, immunization campaigns is something that Africa is good at. We've been running big campaigns, especially for polio, and I believe you are aware of the polio eradication on the continent in Africa. So the system and the capacity is there to run big vaccination or immunization campaigns on the continent. What we need to do is to make sure that we roll it out as quickly as possible to catch up with those children that have missed their vaccinations.
More than 362,000 pregnant women in Nigeria, for example, missing their antenatal care between March and August. What is the direct impact of that? Of course, what does it mean for those mothers, but also for the children who, of course, will be born out of that?
Of course, the impact of missing antenatal care could actually be serious on a pregnant mother and the unborn child. We know the problem we have. We are still battling with high maternal mortality in Africa, And when these women begin to miss their services, then the chances of having some risks of getting into this problem is there, because some of those problems you can actually pick them early and intervene to prevent this mortality. Skilled birth attendant is also important, so that women do not stay and deliver at home, so that when they are attended by a skilled nurse or a midwife or even a doctor in a hospital, you are reducing the chances of developing complications during and after the delivery, and it increases the chances of survival for both the mother and the child.
All right, as we wrap up the conversation, Dr. Stephen, what is the view of the WHO, particularly on the reality of a second wave on the African continent? The National Coronavirus Command Council here in South Africa will be meeting with some behavioral experts, as well as some experts as far as the pandemic is concerned, to discuss the behavior of South Africans and some South Africans who are beginning to drop the ball in terms of their behavior. Is it a far-gone conclusion that we will see a second wave on the continent, or you have a different view?
Yes, in Africa, the risk of second wave is also high. Just like the risk of importation of cases right from the beginning of outbreak was high for every country in the world, it's the same even for the second wave. We know that the outbreak of COVID-19 is spread by human behavior. When we interact, we expose people, and then people contract this virus. So we need to make sure that we continue to observe the preventive measures, wearing our face masks, keeping our distance away from others, washing our hands regularly, avoiding mass gatherings. So if it is not necessary, let's try to avoid where we have a lot of gathering of people, being vigilant at all times, because if we lower our guard at this point, the chances that we could have a second wave is also there. But we are at a very good stage right now to mitigate the risks of this second wave.
We appreciate your time. The technical officer at the World Health Organization Regional Office for Africa, Dr. Mary Stephen.